Hi, my name is Mike Penna, and today we're going to be talking about sexually transmitted infections. Specifically, we're going to be talking about syphilis. We're going to cover a lot of information, so not all of the information that I talk about will be in the slides. So feel free to pause, write things down at any point during the presentation. This presentation has graphic content and may not be suitable for all audiences. So here we have the spirochete, the spiral-shaped syphilis disease. So what is syphilis? You can see from the picture there, it doesn't look very dangerous, but it's really bad. So syphilis is a spirochete. That means that it basically is a spiral shaped, and it's a treponema pallidum is the name, and it's considered the great imposter because if it's not caught early on, a lot of the signs and symptoms can actually be mistaken for other disease processes. And when you go to your doctor, they may not be able to figure out exactly what's going on at first. And because of this, it's also a complex disease. It affects multiple organs over a very long period of time, 15, 20 years sometimes. So it's very complex. So how common syphilis is? It's one of those things where it comes and it goes. So right now it's on an upswing. And so it's becoming very common. It's pushing its way to number 2 behind gonorrhea, and then of course chlamydia being number 1. It's mandatory to report, and in 2014 there were 63,450 new cases in the United States. To put that into perspective, there were 43,750 new cases of HIV in the same year. So there's actually 20,000 more cases of syphilis than HIV. It's actually very much starting to climb, and especially in certain populations. Again, these numbers are only in the ones that sought treatment and the ones who actually found out they had the disease. A lot of people can actually go for quite a while and not know they have it, or they can be diagnosed 10, 15 years down the line. 2/3 of all these cases, for new cases, are between 14 and 24. So you get it the same way you get all other sexually transmitted infections, by having unprotected sex. Either vaginally, anally, or orally. It can also be transmitted from the infected mother to the baby, and that is considered congenital syphilis. So who's at risk? Same kind of thing with gonorrhea and chlamydia. So women under the age of 25, those who are sexually active, lower socioeconomic statuses, those in the African American culture, Native Americans, and men who are having sex with men. Syphilis works kind of an interesting way. So it's small, it's gram-negative, it's spiral-shaped, and it takes hold, and it has a dormancy period of about 3 weeks. Because of this, it can be one of those things where you don't correlate that the infection took place necessarily right around the time that there was an unprotected sex. It can mimic other diseases very easily, so it's hard to actually detect. And there's 3 distinct stages, the primary, secondary, and tertiary, and can lead to neurosyphilis if left untreated. The clinical manifestations, again, I talked about the 3 stages, primary, secondary, and tertiary. There's actually a stage in between secondary and tertiary that is considered the latent stage, which is basically where there's no symptoms and you haven't made it into that tertiary category yet. So the primary syphilis is basically there's going to be a canker, and it's going to be at the site of the infection. It's going to be painless, and it can last about 3 weeks or so. It starts around the 3-week mark, and it goes to about the 6-week mark. It will go away regardless of treatment. So even if the patient's not treated, it will go away. And it's always going to be at the source of the infection. So if the vagina is infected, that's where this canker will be. It will have an induration. It will be kind of deep. And so because it could be in the mouth, or it could be in the vagina or the anus, it could go undetected and you could not know you have syphilis in this primary stage. This is what the induration looks like on the end of a penis. On this gentleman here, he would probably notice this. This would be something that would be noticed. Hopefully go to the doctor and get treated for this. Now on this one here, this one's on the tongue, and it would be very difficult to notice this one. Unless you were looking at your tongue, I don't think you would notice this one. So in this case, this could go unnoticed. And then that leads to the secondary syphilis, which starts around the 10-week mark, and it can go up to 2 years, but typically it's about 1.5 years. So there'll be a development of a rash, typically not itching. It can be very faint in color, and there's almost always a fever associated with this. So a rash and a fever can be a lot of things. And again, this is where it's a mimicker and very difficult for a doctor to diagnose. So here's what one of the classic presentations look like, where you have a rash on the sole of your foot, and it can also be on the sole of your hands. There are very few rashes that actually affect the soles of your hands and feet, and so if there is a rash on the sole or on the palm of the hand, then this is very indicative of syphilis. Again, I talked about the rash on this gentleman. His skin tone's a little bit darker, African American, and so you can see it a little bit more, but if somebody's really light skinned, you may not see it. These are typically flat. They don't stick up from the skin. They're not raised. So we went from the secondary stage, and now we go into latent stage. And in that latent stage, from roughly a year and a half or so, when the symptoms go away, to the 3-year mark, there are no symptoms. And in this the latent stage, basically it's just sitting dormant within the body. This leads to a tertiary syphilis. So in this syphilis, this is where you see the classic abnormalities and the really aggressive progression of the disease that you hear people talk about. So one of the things that they talk about that happens is gumma. So gumma is when there's a source of an infection within the body, whether it's like the bone, the skin, or an organ, and there will be a buildup of tissue from that infection. And so you'll have, if it's the bone will actually grow outward, almost like a bump. The skin, same way, the skin can have bumps. You can have them on organs from the tissue. There's a medical text that show a gentleman from the 1800s who had what appeared to be 2 protrusions coming off of his skull, and they almost look like horns. And what they found out later through DNA sequencing was that this patient actually had syphilis, and that these were most likely the result of the gumma from the syphilis, where the bone had actually deformed and grown outward, resembling to what they referred to at the time horns. If this progresses on, it can affect other organs, it can cause damage within the different organs, and eventually it can lead to neurosyphilis. So the tertiary symptoms can last, like I said, are in that 3 to 10 year range. It can go up to about 15 years though, and actually once you're infected, it could be a long dormant period. So it could go 10 years down the line. You didn't notice the canker sore, you maybe had a real light rash, maybe it's winter, you didn't really notice it on your skin, and now 10 years down the line, all of a sudden you start developing very serious complications and you can't figure out why. This is why they call it the great mimic. So with neurosyphilis, which is probably the most detrimental to the patient, would be, there's a couple of things that happen here. So if it's on the front of the spinal cord, you can look at general paresis, so loss of sensation, motor function, or mental disorders. If it's on the backside, it's on the tabes dorsalis, and you can look at loss of vibration or proprioception. So syphilis is diagnosed using, from a gold standard perspective, dark field microscopy. This testing is very expensive and technologically advanced, so a lot of places do not have it, and so it's not used very commonly. The more common would be the blood test, and there's 2 types. There's the non-trepononal and the trepononal. The non-trepononal is a little simpler and inexpensive. The trepononal one appears earlier as far as a testing result, so typically laboratories will try to use the trepononal, but to get a more specific and sensitive diagnosis, it should actually be the other way around. They should be starting with the non-trepononal test first to diagnose syphilis. Here's a picture of a syphilis rapid screen test. It can be done in about 15 minutes at home. Don't have to go into the clinic, and you can find out your status. Syphilis is treated with antibiotics similar to chlamydia and gonorrhea, except that it's going to be penicillin, and specifically benzathine penicillin G. There are multiple combinations of penicillin out there, and it's not recommended to use combinations. It actually is very specific to this penicillin. Pregnant women are particularly at risk. If they are pregnant and they have syphilis, they can pass it on to the baby when it's born, and this is congenital syphilis. Or they can actually have stillbirths or spontaneous abortions from having syphilis during pregnancy. So it is routinely screened and encouraged that if pregnant women are allergic to penicillin, that they actually get the antibiotic anyway, regardless of the allergy, and that they're just monitored for the allergic reaction that comes from it. like to thank you for watching this presentation. I hope you enjoyed it and that you learned something, and that you will check out my other presentations. Thank you.